So our first short speaker will be Dr. Colin Perry of the UK, and he'll speak on Ayurveda and Homotoxicology.
Hello everybody. I'm enjoying this conference and I hope you all are too. I know I've got a brief session. So here we are, that's me, I'm Colin, I'm a naturopath. And I'm going to be talking about Ayurveda and homotoxicology. Now we all know Ayurveda is ancient, but homotoxicology isn't so old. It comes from the homeopathic tradition and was formulated by Dr. Heinz Heinrich Reckweg in 1952. So it's a more recent form of holistic healing. The aims of this presentation to look at some similarities between Ayurveda and homotoxicology, discuss musculoskeletal problems and Marma points in the lower limb, and illustrate how Marma points can assist in homotoxicological treatment. So, as we all know, Ayurveda emphasizes the importance of cleansing, tonification, and revitalization. And this is not incompatible with detoxification, inflammatory modulation, and cellular support, which are the three pillars of homotoxicology. They both have 6 stages of healing, disease stages, which you can transcribe one to the other. Let's say, for instance, when you talk about arthritis, manifestation, or Vyakti, that's the degeneration phase in homotoxicology. And they both use combination preparations. You don't have to be a homeopath to use homotoxicology. You need to know what condition or what conditions you think the patient's suffering from, so it's very individualistic. But you don't have to actually be trained as a homeopath. I have been, but I'm sure I could train you all in homotoxicology in a couple of days. So we go on. Same thing about cleansing. Ayurvedic philosophy suggests that the state of the bones is reflected in the state of the colon, where nutrients are absorbed for the bones. And so as we know, disturbed vata in the colon can affect the absorption and result in conditions such as arthritis and arthrosis. So always consider treating the colon in conjunction. And homotoxicology does this. An essential preparation is for cleansing the colon is Nux vomica homocord. This is used with berberis homocord for cleansing kidneys, and lymphomayasote homocord, which detoxifies the whole system through the lymphatic system. And we all know how to detox the colon ayurvedically, so I won't go into that. So what are the aims of homotoxicology? Clean the terrain of the patient, to regulate inflammation, but not suppress it completely, sustain the affected tissue, regenerate as much as we can, improve the quality of life, and I think you'll all agree this is also the aim of Ayurveda. So Marmani, which we all know is the plural of Marma, are energy points, similar in concept to acupuncture points. They can be used clinically in a diagnostic or therapeutic manner, and I put some reference books up there, and the Marma points that I'm going to illustrate quickly are drawn from all the reference books you see. So here we go, the Sphige, the Sakthi Urvi posterior and Janu posterior, and down front of the leg, side of the leg, laterally. And I can't go into all the meaning of all these. A lot of them also correspond with Chinese acupuncture points as well. So I think I'm giving you an idea. There's a few extra points in the acupuncture points. And here we have a patient, 67, standing on a podoscope. You see they have, or perhaps you cannot see that the right foot, there's a higher pressure distribution. They're starting to have arthritis in the hip because one leg, the right leg in this case, was shorter than the left. So simply we had to sort of put them in devices to correct that, and also we gave them treatment. This is an interesting device. It can pick up pain because if you set it on a setting to pick up low electrical resistance, this is basically Marma points, acupuncture points, pain points, and trigger points. And you can also use it for treating, because it is very good for children who are frightened of needles, because it's non-penetrating. That's a low-level laser I use on marmor points. And there's some heel preparations, which are homotoxicological preparations. They come from Germany. The Italians also produce some called Guna, a company called Guna does that. And there we are, just traditional Chinese acupuncture. But I've potentized the needles prior to applying them with homotoxicology. And there I am injecting straight into points. This is a result, this is a sort of 6 months after a compound ankle fracture, I think. The patient came to me because they wanted to play 9 holes of golf and they couldn't really walk at all, not more than about 5 minutes. So we started the treatment in April, and by October they're doing their 9 rounds of golf, so they're pretty pleased. Considering they're 68 years of age, I was pretty pleased too. There we are, injecting into the side of the leg, around the lateral sharana and the uru. It's ever so easy to do. You can just raise blebs under the skin if you not sort of do deep injections all the time, but I've injected into joints as well with great success. Kashipra, I'm just injecting in there. And that's stomach 44. And namaste.
Thank you, Dr. Perry. You got the award for on-timeness. And there seem to be many parallels between Ayurveda and homotoxicology. We appreciate that.